Well, hello, my friends. Welcome back to another episode of the Doctors Changing Medicine podcast. I am excited today, and I have such a great guest here. You'll see in a second why. And this is one of those sit back, relax, get ready to be blown away type of episodes because I have Dr. Kim Tranquanda here, and she is phenomenal. She has had like a long career. She has excelled in that. And then she decided, I want to solve world problems. Okay. And this is what she's doing now. She's solving global problems. She's retooling herself to be able to pull that off. And I'm always so inspired. I was a guest on her podcast, which you should check out, by the way. We're going to talk about that later in the show. And I was like, man, I need to talk to you more, right? I think I kept her on the phone for 15 minutes after my interview. I was like, wait, what? You do what? What did you just say? So I'm glad that I have her on. So Dr. Kim, welcome to the show. Please introduce yourself to the peoples and let them know why I'm so excited you're on here today.
Boy, am I so excited to be on your podcast. Dr. Una, when you and I speak, I think the world opens. Two powerful visionary women coming together to share their ideas is a powerful thing. So I am Dr. Kim Tranquanda. I'm an emergency physician. And that is still such a core part of my identity. I've been an emergency physician for 25 years. The CEO and founder of the Healthcare Alliance for an Equitable World, where we are building an international global community of healthcare workers to solve the 10 million healthcare workforce gap, especially for the people that need it the most, the majority of the world that lives in low and low middle income countries.
So, guys, you can see, right? Like, there's a global problem. There is a 10 million clinician provider deficit. I'm like, maybe I should take that on, right? And so, I mean, like, I just get blown away. So let's backpedal a little bit, right? So here you are. You're working the ED. You absolutely love it. You're enjoying your career. How do you make that transition? Like, what triggered this whole thing? Because this is not normal for emergency room docs. Like, it just isn't.
I think it can be normal. So, emergency doctors sit at what I call the hub of the healthcare system, where everything that falls through the cracks in healthcare and society ends up in our space. And so I've spent a career watching people who can't get health care come to the emergency department to get health care. I've watched people that have great health insurance at the worst moments of their life and never thought they would be in an emergency room. But, that's really built this heightened awareness about what is missing in healthcare and how people are being left out. We treat all of the people that most people ignore and don't see. So the unhoused, those that are using substances, those that are trafficked, children that are in violent home situations, women, and I mean, we have, for a lot of people, a pretty jaded view of the world, but it's important to have those lenses open wide to see the world because even on my show I talked to one of our guests that worked with HIV in people using IV drugs in Africa and how it was eye-opening for them. You can't ignore these problems, these issues, and think they're not going to affect you. They affect all of us. So as dark and difficult as those things are, I think my career in emergency medicine prepared me to be thinking about healthcare more than at a global place, but at a place for how can I, as a physician, the person that's supposed to be the one in control here who really isn't actually in control, but how can we actually take some control and be an advocate and create the real changes that are going to help everybody? And at this place in my life, realizing that everybody is also me. I'm going to be in my moment of greatest need one day, right? And what is going to be waiting for me if I don't address this system? And my descendants are going to be in an emergency room and in a hospital and in an ICU or in an OR one day. And what's going to be waiting for them? What have I learned in this great career in healthcare leadership and being in those rooms that I need to bring to the table to make that future better?
I have lots of questions. Okay, so I'm a pediatrician, and when I was practicing full time, I would say I was probably shielded from a lot of that, right? I come in, I'm doing a lot of well checks, I'm doing a lot of health education. I'm seeing the kid who has an ear infection, a sore throat, the teenager who needs some guidance, all those kind of things. So I'm not really like, yes, I see some of the collapse of the healthcare system and the impact that is having, but I'm shielded from a lot of it, right? And so and I think this is very important because when we think about, turning healthcare right side up, there are multiple layers there, right? And entrepreneurship, which is kind of my zone, is one of the huge ones. But advocacy is already there, but you can't advocate for what you don't know is an issue, right? And so you made a statement about, yes, we have a jaded view, but we kind of want to have our eyes like wide open and see the world for the way it is. For a physician who's like, I think I may have been in a bubble compared to what you're talking about. How do they get to find out about that? Like, how do they get the proper perspective of the healthcare space?
Yeah, I love this question. And this came alive for me during COVID. So let's go back a little bit. I think sometimes we're trying to forget COVID, and what we need to do is a little bit analyze COVID and pull out the lessons of COVID. So I'm working in a little community ED during COVID, and I have people dying of hypoxia in a hospital that doesn't have an ICU, that doesn't have a pulmonologist, doesn't have any specialists at all. It's just me, Kim Tranquanda, the ER doc in the ER, and a hospitalist that rounds on a few patients on the floor. And I'm trying to get patients to life-saving care at other facilities. And I call the hospitals that have everything, right? They have the multiple specialties and the ICUs, and they go, yeah, we can't help you right now. We don't have enough beds, which translates into we don't have enough nurses, right, to open the beds. Or sometimes it means we're playing COVID versus non-COVID beds, right? So we're not going to open a COVID bed because we need to have some non-COVID beds for our OR patients. So there's so much happening in the background. But when you talk to doctors, even doctor to doctor, and I've been in their spot, and I hear their responses where they're like, yeah, just do this with the patient. And sorry, we can't help you. And you realize there's no perspective. They don't even understand what a critical access hospital is in their own community, an hour away, much less what is happening in rural Kenya or Uganda or the Philippines. And so I love that. That's the space I want to be in. So I created the Voices of Healthcare Equity podcast thanks to Dr. Una and the EBS communities. Wonderful teaching and encouragement about what it means to be visible and form community. And through that podcast, I bring people on to talk about all of those things in all of those places, right? So, where have you worked? What is going on there? What is that like? And so, through that podcast, we can build a community with some perspective, not only on what's going on outside of our world, but who are the people doing the work in those places? And how can we work together and collaborate and build this global community? Because as a community, that's where the true influence and power is, right? No one person can solve this global problem, but we all need to solve this global problem and we want to solve it. So we need to come together and see it as community. So I have used the Voices of Healthcare Equity podcast to try to build that perspective. But I would ask everyone to just be curious. Be curious and be open minded, because burnout has made wounded physicians and healthcare community defensive and closed. And a lot of times there is a barrier to being opened to the fact that um, you have more abundance than you think, and that you have more to offer than you think. So I would ask people to be open, and I know that community will help people have the strength to do that.
Oh man, I mean, we can stop here and unpack everything because and this is so this is the reason why I wanted to pause here for a second, right? What you're doing is you're calling physicians to own their leadership, right? Like, don't be stuck where you are. Don't be stuck with your experience. Don't be stuck in your world. The healthcare space is waiting on us to rise, right? Now, part of rising is kind of looking out of our little, like little worlds and looking like what exactly is going on here? What are the problems here? What problem am I uniquely able to solve? And like you said, collaboration is required because you're very brilliant, but you don't have the answers. I'm very brilliant, but I don't have all the answers. But just on this interview, look at the way this works. So you're like, man, we need to help people change their perspective. We need to help people see what is actually going on in healthcare. I know a community is the answer. I know sharing the different stories is the answer. That is powerful. And on the other side, I'm like, okay, I know that physicians are the ones who are the answer for this space, but we need to be empowered to be able to do what we need to do. Do you see what I'm saying? So you're broadening my perspective. I'm helping you launch a podcast, and it goes on and on. Like, the collaboration is so powerful because there are things you uniquely see that I'm like, huh, I never thought about that. There are things I uniquely see, and you're like, huh, I never thought of that. That is where we need to be as physicians, because if we can come to that space, then we'll be in a position where we can change healthcare. Like, I'm in my part, doing my part, you're on your part, doing your part. What if there are 100,000 of us? My favorite number, right? Doing our parts. What would healthcare look like? So that is so powerful. And please, before, so we don't miss this, tell people where to find your podcast, because you're listening. I want you to go subscribe so you can broaden your perspective with every single episode.
So the Voices of Healthcare Equity podcast is currently available on Apple Podcast and Spotify. Voices of Healthcare Equity with
All
Dr.
right.
Kim Tranquanda.
There you go. Okay, so find it. I may or may not have featured on it, but go find it. Okay. I have featured on it. Okay. So now you identified the problem, you identified that, okay, perspectives need to be shifted. You started the podcast, all that. How did you determine that, the model you're using of recruiting, people who are in healthcare to fill up this gap, like that's the answer to the problem, right? Because there's so many ways you could have gone at this, but this is the way you chose.
So, one of the basic tenets of entrepreneurship is you're most likely going to be successful in what you are expert in. So start with what you know and start with your community. Yeah, I want this to be a global community, but what am I expert in? I'm expert in emergency medicine. I'm expert in telehealth emergency medicine. I'm expert in healthcare leadership. So how do I leverage those things to make a change? And because of that, I have insight. I have insight into our healthcare community, and I have insight into what our needs and motivations are. So that is the place that I can bring something special. I mean, a lot of people build a lot of things, right? And they build things sometimes that are completely outside of their area of expertise. I could be a computer whiz trying to build this right now. It's not going to have the same impact, and it's not going to have the same outcomes as me, Kim Tranquanda, an emergency physician, building this organization. And so that's why I think that physicians in the healthcare community are key to this. I spoke to people. I've been speaking to people for decades, right? And would this be something they're interested in? And I'm going to tell you, everybody's interested in this. And not only that, this is like an infusion of saline to a dehydrated patient. We need this now more than ever. I have created an organization where I am inviting licensed, trained physicians and healthcare workers anywhere across the globe to just 2 hours get on their computer just like this. The platform is so easy to learn, and you can connect with a healthcare worker in the Philippines, in Kenya, in Uganda, soon in South Africa, anywhere across the globe, and have a real life-changing impact on patients. More than that, be part of changing healthcare and bringing equity for the world. So you're part of something amazing. You are learning, you're lifting that lens, you're gaining a greater perspective. It's not what's happening in my little neck of the woods, but look at what's happening all over the world. You're learning. I know that we love that, right? Most of us are lifelong learners, and we love that learning. And now you're also becoming a part of a community. I got colleagues in England, I got colleagues in India, I got colleagues in China, I got colleagues all over the world. And you all, when we do that, we are so much better as a community. I think I've spoken with Dr. Una before, but that community, that international community, is what saved our lives during the darkest period in my generation's healthcare life. During COVID, that international community kept my emergency department team from dying, because I learned from people in China, I learned from people in Italy, I learned from people in various countries in Africa, what they were doing, what was happening with the virus, and how to protect my team and how to protect myself and what equipment to use. I didn't learn it from my local community. There was a lot of things happening politically to keep that from happening. So let's take the lessons, let's learn them, and let's amplify them for the future.
All right, woman, you just gave us three master classes. Is this what you're going to do every time you answer a question? Because now I had a friend I was talking with, and she was going through some personal challenges. And she says it's very strange that the thing that has helped me the most go through this time is my clients, my team, the community I built. Like the business I built to help others has been the greatest source of help for me. And that's exactly right. Like, I didn't know this part. You know, we talked about many things, but I didn't know this, that the international community you built to serve was the source of saving you and your team, right? Like, it's so wild to me that we go out to intend to have this huge impact, but it turns around and we almost gain more. You know what I mean? And that's wild. I want to pick on something you said, because in entrepreneurship, this gets missed all the time, and you did it so masterfully. You're like, okay, this is a problem in healthcare. These are my, you took inventory of your skills, your expertise, your experience. You're like, okay, emergency medicine, telehealth emergency medicine, healthcare leadership, all of that. You're like, okay, I will use this to serve my world. A lot of times, the things that are in our zone of genius, we're like, all I know how to do is this. And so the reason I can't do this big thing is because I don't know how to do these seven other things. And you're like, no, like I may not know those seven other things, but I know these three things. And with these three things, we're going to change the world, right? And so for you listening, like that is so critical that you stop and take inventory. What is my zone of genius? Don't downplay it. Don't say it's common. Don't say all I can do is I am just a, like, you know how when people say just a pediatrician, I'm like, stop saying that. There's nothing just about being a pediatrician, right? But that is such a powerful concept, and I love the way you just own that. That is so cool, so cool. Okay, so you talked about numbers, right? So talk to me about what this deficit is. Talk to me how you came up with this 2 hours per healthcare worker and all of that, because I heard you talk about it when I was a guest on your podcast. I was like, what did she just say? Did she just reduce a global problem to a math equation that I can understand?
Yeah. So there are 13 million physicians globally, currently, fully trained physicians in the world. There's 30 million nurses and midwives, 4.6 million dentists. So we have a number, right? Once you start, you got a number. If we could get just 1% of that community, let's start with 1% of those 13 million doctors. That falls really close to Dr. Una's 100,000 physicians, 100,000, 130, six of one, half a dozen the other. It's close enough, 100,000. We break that down into 2 hour blocks. We've made the entry into doing this work so easy that it respects the fact that people are busy and have a lot of things to do. And it respects the fact that their time is valuable and they don't want to have a huge commitment, especially while they're trying to figure this out. So 2 hours of your time once a year, if we can get 1% of that global community to get 2 hours once a year, such a small bar, we would have 700 hours every day of extra physician workforce to care for the 88% of the world that currently has less than half of the healthcare workforce.
Hang on. So 2 hours. So you guys can see why my mind was blown. I was like, wait, did you? So 2 hours a year for 1% of the workforce, and we would have 700 hours a day. Now you have me excited so much so that I have to do the math. So 700 hours a day is 29 days in a day. That is, okay. And wait, okay, so I have all kinds of thoughts. The first thought I have is when you said 13 million, I was like, wait, there's a million in the US. There's 13 million in the world, and there's a million in the US. And there are a gazillion countries. And so for me, my thought is, oh, we have a responsibility, right? Like it's not just a nice to do, but we also have a responsibility because for 2 hours, that is like two shows on Netflix, two episodes of a show on Netflix. You know what I mean? Like we could literally touch the world. That is so, and that is why I was so blown away. I'm like, oh my goodness, that is amazing. We have a responsibility, and for you listening, she's going to give us information at the end and all, but I will challenge you to go sign up. It's 2 hours. Like you can do it next week and be done. You know what I'm saying? Like it's 2 hours. Okay, I'm backing up. So tell me more about this because, okay. So what has happened since you did this equate? First of all, how did you feel after you did the math? And you're like, wait a minute. But what has happened since then, and what are you aspiring to accomplish? Say the next 6 months, next 12 months with this.
Yes. So um, I've broken this down so that that 1% goal can be achieved within 5 years. And so for this year, we want to have 100 at least physicians. But look, when we break these shifts down into 2 hours, that gives us 12 shifts per day, 84 shifts per week, 360 shifts per month. You can see that if we just get 360 people doing this for 2 hours, we have 24-hour coverage by fully trained physicians. We have the need and we have the communities that want to work with us. We are currently launching a program in Kenya and Uganda, two very rural hospitals that operate basically with one physician and one primary care physician and sometimes a surgeon on call as their coverage. So kind of like my community ED that I work in is there every day. And then several clinics that are an hour or more away from them that they've never been connected with before, and two boarding schools. Now, boarding schools carry a heavy weight of taking care of children, many of whom have been orphaned by either war or disease, and they live at the boarding home, and there's a full-time nurse that is their primary caregiver. And connecting these folks together for the first time to the rural hospital and then to a team of specialists and emergency physicians who are available for them 24 hours a day. 24 hours is important because now we're working globally. We're working across time zones. In East Africa, nighttime is daytime for us, and our daytime is their nighttime. So as we bring in a global community of physicians, we're going to have folks in Europe and in Africa who are in the same time zone. It's going to be easier for them to take care of those time slots. But just 2 hours. I don't mind waking up from 2 to 4 a.m. once a month to do this work. I have done it. I've done it when we work in the Philippines. So we also do work in the Philippines with missions, and currently several groups in South Africa in the more rural eastern Cape of South Africa are looking to work with us to do this work. So I really want to invite folks to come. You're going to love it. Our teams that do it are like, wow, this is so easy. This is so great. And you'll learn and you'll be a little uncomfortable because suddenly you don't have everything available to you. You're like, whoa, I don't have an IV right this second. We are actually bringing those things to the clinics, and we're making sure that there's IVs there and things that we can save people's lives within an hour of getting them transported. But we're going to bring those things to the community to help them grow as well. So they benefit from being part of a larger community as well.
Well, Dr. Kim, I'll tell you this. I love your vision. I believe in your vision. It's the reason I brought you out on here so we can spread the word about what it is you do. Um, I know that there are a number of ways to support you. One would definitely be, get the podcast so you can start enlarging your perspective. The world is a very big place. It's so much bigger. It's so much bigger than our world, right? Like the whole world is a very big place. The second thing would be to sign up, and I'll let you tell us where to do that in a second. And I'm sure that there is also an opportunity to donate as well. So talk to us about like direct people on where to go. And guys, information is really good. Being inspired is really good. Being blown away by Dr. Kim and what she's doing is really good. But taking action is where that's where the rubber meets the road. That's where all the magic happens. Your life can totally be changed by inserting yourself in a community like this. She's made it so simple. Like the math is so simple. But in 5 years, like by the time she hits the 5 year mark, she would have hit her goal, right? So I want to challenge you to not just hear this, but she's going to give us some direction on where to go to sign up and to donate. And I want to challenge you to do your part. Okay? Because when we all, I mean, there is a million of us. That's crazy. Okay, go ahead.
All right. It's one place to go that's very easy. It's haew.org, https://haew.org. There's information on there about our team, our programs. You can donate, you can volunteer from that site, and you'll be contacted by me and my team to get you signed up. And then, of course, share it, spread the word. If you know of any organizations that want to collaborate with us, wonderful. If you know of any big donors, hey, Bill, Melinda Gates, I'm here, ready. Please feel free to let them know about our website. So, yes, you can support us in many ways, which include sharing the information about what we're doing in our content with someone that wants to volunteer, donate, and be a part of our team. Look, the healthcare has to change. We are all going to need this care at some time in our life. And more than 80% of the world is not being served right now. Who doesn't want to be a part of that? You want to be a part of that. That is going to be amazing because human potential. There are great humans waiting to be helped and fulfill their full potential out there in the world.
All goosebumps, goosebumps everywhere. Be like that, Dr. Kim. Okay. Well, this is great. Like she said, go do your part and spread the word. Right, those are the two big things that we're doing here. Dr. Kim, I want you to talk to somebody who was you when you had the idea, but you weren't ready to implement. Probably there was some fears. Maybe there was some imposter syndrome. Maybe like, I don't know, or like, is this a thing? But I believe that as physicians, we're so loaded with all the solutions required in healthcare and beyond. Like we are what we can create, but sometimes we buy into this ideology that we're one trick ponies or the only thing I can do is see patients. And there's nothing only about that, right? But if something's tugging at you and you don't know which way to go, you don't know what to do, like what would you tell that person? Because you were there. What would you tell you before you got here?
Yeah. Self belief. I think we have it. Most of us would not have gotten here in the first place if in your most innocent, most vulnerable moment of your life that I decided about this journey when I was 18. I had no reason to believe that I could do this. I didn't have money, connections, anything. But go back to that moment and realize how basically and very innocently and truly you believed in yourself and knew that you could do something hard. I did not 4 years ago think telehealth and emergency medicine went together, but I knew that there was something tugging at me, like Dr. Una said. And I was intimidated. How do I learn all of these computer things? I was one of them doctors that hated the computer. Oh my God, keep me away from the computer. Can I just touch patients and write a note? That would be awesome. But I let myself be uncomfortable. And I low key learned how to code and put together a whole program so that it fit people like me, real life practicing doctors, and made that work. And when I did that, I said, I need to make sure this isn't a fluke. And I walked away from a comfortable position and did it again. And I said, well, okay, wow, I can do this again, and I can do it bigger, and I can do more. And that let my mind be free to say, you can learn the missing skills. Whatever it is you're missing, you can learn that. Even more, you don't own any of this, right? Everything I have done, it's because people trust me and want to work with me, see the vision and collaborate with me. So I don't own it. Like the way you build something big is to not own it, is to give it to people and make it with people. And so get uncomfortable. You can always learn new skills. We actually love learning new skills. I went to, a corporate governance class and was there with big CEOs. And like, I was like, they were like, wow, what are you doing here? You're a doctor. And this, and it's like, put yourself in those rooms and not be intimidated, because when you get there, you're like, people are people. We're all the same. It's okay. We have different skills, and there's not really a room that you can't be in. So that's what I'd say to people.
Okay. Well, be like that. Like I said, masterclass after masterclass. But that's amazing. Thank you for coming to share. Thank you for owning the vision. Thank you for maybe initially being intimidated by the global vision, but saying, "Yeah, I've done hard things. I'll just do another hard thing. No biggie. Rinse and repeat." Because you're solving a global problem. I'm still blown away by it. And, I'm just grateful that you do what you do. So, everyone, go follow her, subscribe to the podcast, go to the website, go volunteer, go donate, go spread the word, share this episode. Because this is how change is made. And let this be your reminder that as a physician, you are so loaded with the solutions that your world needs. It's not a cliche. Like, you see an example here, and I bring examples on here every week for you to see. You are the answer. So rise and take your place, up level what you're doing. You may feel a little intimidated. The best of us do. We just don't let it stop us, right? So I want to invite you to do that too. So Dr. Kim, thank you so much for coming on the show. This was absolutely amazing.
Dr. Una, this is wonderful. Thank you very much for inviting me on the show. I always enjoy having a mind blowing discussion with you.
Yeah, because you have mind blowing things to say. All right, people, go share the episode, go check her out, and I will see you on the next episode of the Doctors Changing Medicine podcast.